Thank you everyone for joining us today, taking the time to learn more about Praxis and Ulixacaltamide, which is our product that we have in development for treating essential tremor. And of course, thank you to the IETF, our great partners in communicating with you. I'm Carol Clark. I'm the patient advocacy lead for movement disorders at Praxis. And I'm here today with Dr. Monique Giroux. Monique, can you tell us a little bit about yourself?
Sure. Hi, everybody. My name is Monique Giroux, and I'll be giving the presentation today. So I am a movement disorder neurologist for people with multiple movement disorders, including essential tremor. I just recently joined Praxis late last year, and it's an amazing company, amazing team, and really feel fortunate that I could work on this project. It really is a team approach.
Great. Thanks, everyone. Before we get started, we'd like to extend our sincere thank you to everyone in the ET patient and advocacy community. We greatly value our collaboration with you and especially appreciate you sharing your personal stories and experiences. It's these experiences that guide our daily work at Praxis, and it's truly an honor and a privilege to serve you. So this is our mission. I'm not going to read the slide, but not sure if everyone is familiar with us. We are a biopharmaceutical company focused on developing potential treatments for people with central nervous system disorders. And these include disorders like essential tremor and epilepsy. A lot goes into developing a drug. It takes passion, focus, and trust between the scientists and physicians working with us. But it asks the most of you, the people living with ET who are looking for better options. It takes your commitment and trust, and we never take that for granted. As you see, this is our mission statement. We're really focused on delivering life-altering treatments faster and more effectively than has ever been done before, and do it again and again. As you probably are all well aware, ET is the most common movement disorder, impacting millions of people in the US and even more care partners to them. And that's important because it means that you're not alone. We know that ET impacts more than tremor, as people are unable to perform everyday tasks such as eating, writing, and dressing that people without ET often take for granted. ET is a serious condition, and we're serious about finding a better way to help individuals with this condition. Many of you may have experience with medications for ET, and hopefully it has provided you with some relief. Unfortunately, we've heard that current therapies often fail to meet the needs of most people with ET. This isn't surprising, as no existing treatments were developed with this disorder in mind. For some, we've heard that the side effects of treatment can be worse than the tremor itself. For others, we're seeing people left coping with symptoms without appropriate treatment or facing difficult choices around invasive procedures that can carry risk and may not work. Our goal at Praxis is we want to develop specific treatments to help the patients in need. And our goal with Ulixacaltamide, it's a treatment expressly developed with your needs in mind. I will now turn it over to Monique, who will talk to you more about Ulixacaltamide.
Thank you, Carol. So I'm going to present the results of our clinical trial, but also describe how we've developed a program which really does focus on your needs and what people living with essential tremor need from a potential treatment and drug. So Ulixacaltamide was developed with essential tremor in mind. The way it works is designed to block a T-type calcium channel blocker in certain parts of the brain, and these parts of the brain are thought to have abnormal patterns of nerve activity, and these abnormal patterns of nerve activity can be potentially associated with essential tremor or with tremor. It's easy to take once a day dosing. It can be taken with and without food, and it's been shown to be well tolerated in our studies to date. So in the next slide, let me just review a T-type calcium channel blocker with you, which is the mechanism of action for Ulixacaltamide. So a T-type calcium channel blocker is a medicine that blocks T-type calcium channels. These channels sit on nerve cells in particular areas of the brain. Activation of these T-type calcium channels are associated with increased nerve cell activation. And when you activate these calcium channels, you then increase nerve cell activity. And the thought is an essential tremor is you're increasing this abnormal burst pattern of nerve cell activity, particular areas of the brain that are thought to be related to essential tremor. So if we can find a way to block these calcium channels, which our drug does, ulixacaltamide, the thought is then we will reduce this abnormal burst pattern of nerve cell activity and improve the symptoms of tremor. So it's a medication that is directly designed to combat the symptoms of essential tremor through these changes. And when we look at a potential medication for approval for a drug, there's multiple steps that we have to go through. And I'm going to present the phase 2 data to you here today. But everywhere from what we call preclinical, the research done on a compound in the laboratory and animal models, moves on to phase 1. And those are small research studies in which we look at healthy individuals, healthy volunteers, looking at the safety of the potential drug, and move on to phase 2, where these again are smaller studies, but we look at the population of interest. So in this particular situation, we look and research people who have essential tremor before moving on to phase 3, which is the larger research trial using and evaluating many more people with essential tremor before approval by the FDA for use of this medication for people with essential tremor. So phase 2 is really about studying the safety of a drug, how tolerable it is, what drug dose level is needed for a drug to have effect. And then phase 3, it gives us the information we need to safely study that drug in a larger population with essential tremor. So our phase 2 study we call Essential 1, and the goal was to evaluate the efficacy, the safety, and the tolerability of ulixacaltamide. And again, to do that with you in mind. And what do I mean by that? Well, what did we measure in this research trial? So our primary measure, our primary outcome was change in severity of symptoms as measured by a modified activities of daily living. So that's what I mean by really a research study with you in mind. What matters to you? What matters to you is performance of your everyday activities. And so these are the measures that we put in place in this clinical trial. In addition, other measures as well, such as change in severity across a range of other ET rating scales, both patient rated and clinician rated, and as well as looking at the safety of the drug. So that's the frequency and severity of potential adverse events or potential side effects as related to the medication. So what is this modified ADL? It looks at multiple aspects of living with essential tremor, both the experience, the functions, the activities you have to do throughout the day, and any complications of these difficulties, like complications we might see in work or chores or just overall disability that one might feel if they're experiencing these symptoms of tremor or difficulties with the functions that tremor causes. So it's really about what is meaningful to you, the person living with essential tremor. And this is what the modified activities of daily living scale incorporates. So in the upper left-hand corner here, you'll see the various elements of the rating scale. So various tasks, for instance, that are affected by tremor: speaking, feeding, drinking, performing hygiene tasks, dressing, and so on. In addition, there are 2 additional items in this rating scale, which we're calling performance items, because the person actually has to perform the task of drawing a spiral, for instance, or handwriting. So items 1 through 11 are measures of individual ADLs that are rated by the person themselves, and items, the spiral and the handwriting is performed in the clinic, and the measurement is done by the clinician as to the degree of severity of the spiral or the handwriting. So each measure is given a score on a scale of 0 to 3, where 0 is normal or very slightly abnormal, and 3 is very severe. So items 1 through 11 are scored by the person themselves living with tremor. And then the spirals and the handwriting are actually scored by the clinician who's watching the person, the participant, actually perform those activities. So who participated in our Essential 1 study? So 132 adults over the age of 18 that had moderate to severe essential tremor. They had to have essential tremor for at least 3 years. They needed to stay on stable doses of their essential tremor medications, treat their essential tremor with the exception of primidone. Primidone is a medication used to treat essential tremor. They would have to discontinue primidone to start this trial, and it's because of the way primidone is metabolized by the liver. And they cannot have had surgery specifically for essential tremor, so that would be something like deep brain stimulation or focused ultrasound. So 132 participants, they were put in 3 groups for the 8-week study. One group received ulixacaltamide at 100 milligram dose. One group received it at 60 milligram dose, and a third group received placebo, which is an inactive compound. So how were these 132 individuals allocated to treatment? So as I mentioned, there was 132 that entered the study and were randomized to one of those treatment arms. Of those 132, 116 were ultimately analyzed. That group is defined. You might say, well, what happened to 16 if 132 entered? That group of patients that was analyzed, that group was decided upon before the study ended, and it consisted of all patients that entered the study. They were randomized to one treatment or the other. They received at least one treatment in the study, and they met criteria for the version 4 of the protocol, the final version of this research protocol. So what happened was there were multiple protocol versions throughout the entire length of the study. The main one, the last one, is version 4. They had to meet all of the criteria for entrance into that version 4, and that left us with 116 participants. Of those 116, 78 were given ulixacaltamide, 38 were given placebo in a blinded fashion. So individuals didn't know which treatment they were getting. We didn't know. The investigators didn't know. Truly a blinded study. Of the participants that received ulixacaltamide, there were 13 that did discontinue sometime within the study early. Of those 13, 9 withdrew because of adverse event. 2 withdrew consent for other reasons, and 2 because they felt lack of efficacy. They felt perhaps maybe it wasn't working. In the placebo group, 38 participants received placebo. 4 discontinued the medicine early. 1 due to adverse event, 2 because they felt there was no benefit, and then for other reasons. So this slide describes the participants in the study, and on the blue column, those are individuals that received ulixacaltamide, and the gray column on the right received placebo. And you can see that we've listed the characteristics by various factors, including age, gender, family history, and so on. So a few things to note is that the age is expected, the average age or mean age in the late 60s to 70s, the slightly more men than women as expected. And the last 3, the MADL scores, that relates to the severity of the tremor upon entry. And you can see that the severity of the tremor upon entry was pretty well balanced when you compare the blue column that received ulixacaltamide versus the placebo group. And that's important because we want these two different groups, those that receive our drug versus those that receive placebo, you want them to have the similar degree of severity going into the study. You can also see there were slightly more people with family history of essential tremor in the ulixacaltamide group, and slightly more people were treated with propranolol in that group as well. So here you will see that ulixacaltamide was well tolerated. In the ulixacaltamide group, 77% had any what we call treatment emergent adverse event, and that is a adverse event or symptom that occurs after a person receives at least one dose of ulixacaltamide. And this is compared to approximately 51% of those that receive placebo. And what you'll see listed here are the actual adverse events that occurred at greater than 5% in our study. And you'll see that dizziness and constipation are at the top of the list, followed by headache, fatigue, anxiety, sense of feeling abnormal, and paresthesias. Fortunately, we had no severe adverse events that were related to treatment. There were 3 overall in 2 participants. One was exacerbation of COPD or chronic obstructive pulmonary disease, and one had esophageal obstruction with gastric adenocarcinoma, which is a form of cancer. And remember, the primary outcome is that modified activity of daily living score. That's a measure of all of those tasks and activities here that we have on the slide, 1 through 11, as well as a drawing of spirals and handwriting, looking at how this changed from the start of the study and then the end of the study. And here we have the results. So at day 56, the end of the study, what we have here is the difference between the participants that were on ulixacaltamide in the blue bar compared to those that were given the placebo in the black bar. And you'll see an improvement, so a downward reflection, an improvement in ulixacaltamide by approximately 3 points compared to an improvement of 1.44 points in the placebo group. That's why it's so important to have placebo-controlled trials, because even with an active placebo, we can measure a potential change. And it's important to compare the two. Does the drug perform better than placebo? Which you see here, there certainly is a trend towards improved ulixacaltamide versus placebo. Now, this did not meet what we call statistical significance, but it gave us a lot of information going forth to plan our future studies. We saw an improvement in ulixacaltamide on the modified activity of daily living score compared to placebo. So we were certainly very pleased with these results. And then you might ask, so what actually got better? That was the total score on the prior slide. Here we have the individual elements, the individual items, and what actually got better. So what this slide shows is change compared to placebo. So it's comparing ulixacaltamide to the individuals on placebo for each of the individual items. And the bar going upwards represents an improvement, going downwards recommends a worsening compared to placebo. So it's all about comparing to placebo. So you'll see all of these activities that showed improvement on this drug: dressing, using a key to unlock a door, general disability, pouring a glass of water, drinking from a glass, writing, carrying trays, performance of hygiene. Other activities such as working, feeding with a spoon, or speaking did not necessarily change. And you'll see the pink items on the right-hand side, and that's the spiral drawing and the handwriting. There's some interesting observations that we've learned and we've made there. One is the spirals, the left-handed spiral here is interesting. And you'll see that that group, ulixacaltamide, did do worse than placebo. But you also need to know that 90% of the participants that enrolled in our clinical trial were right-hand dominant, not left-hand dominant. And there's a lot of variability in how the spirals were done in the using the left hand, and it just added to a lot more noise and variability in the data. It's also interesting, another thing that we learned from this is that the writing assessed by the person with essential tremor done during their usual routine at home, let's say, actually showed a benefit, but the handwriting performed in the office in front of the clinician showed a decline compared to placebo. So there's a discordance there, a disconnect there. And we're still trying to understand this disconnect, but it is different when somebody has to write within their usual activities at home versus come into the clinic and perform a task and write in cursive, for instance, a sentence with the clinician looking on. There might be more things that influence how that is performed, but also how it's rated. What we see here, though, is consistency across tasks and the activities of daily living, which favor improvement on ulixacaltamide versus placebo. We also wanted to look at, so what does this mean? What is the impression? And this is called the patient global impression of change on the left-hand side, and the clinician, the clinical global impression of change on the right-hand side. So turning your attention on the left-hand side, 47% of participants said they were improved in the ulixacaltamide group compared to only 30% in the placebo group. So those are the participants rating their own change. On the right-hand side, you'll see the clinician rating their impression of change, and 42% thought there was improvement in the ulixacaltamide group versus 26% improvement in the placebo group. So whether or not the patient or the participant was rating versus the clinician, you'll see there was a greater percentage improved in the ulixacaltamide group versus the placebo group. So with this data, with this information, we feel that we have what we need to take ulixacaltamide from phase 2 to the next step, and that is phase 3, which is a larger clinical trial for people living with moderate to severe essential tremor to truly demonstrate the efficacy, the benefit, and the safety. And this would be the step needed to support submission and application to the FDA to get approval, to get that indication for use of this drug for essential tremor. And we want to acknowledge all the individuals that were participants in the study, and all of you who are obviously very much advocates for the essential tremor community to make this happen and to help us move this from a phase 2 to a phase 3 clinical trial.
Thank you so much, Monique. I just wanted to end with, as we move into further clinical development, we want to leave the lines of communication and collaboration open. So if you haven't already, I encourage you to go to praxistremor.com and you can sign up for future communications. And I want to end with thanking you all again for your time, and we look forward to keeping this going.